Hello, everybody. My name is Jill Osborne. Hello there, YouTube. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, September 22nd. We were just doing a test stream on Facebook for about a half an hour with screen sharing. But it froze as it was freezing yesterday. I'm really trying to get to the point where we can screen share slideshows and videos and all that sort of stuff, so y'all don't have to keep looking at this mug. But I want to thank everybody on Facebook who was helping us test that mode. And I'm thrilled with it. And I cannot wait to watch it and see what we can do to make better. But I may just have to buy another new computer, a new computer to actually make that work. I don't know. I hate learning new stuff. Like, seriously. Okay, so now we are in the real part of this support group meeting. This is an unscheduled support group meeting. My goal with these meetings is to make you so strong, so knowledgeable, and so informed that nobody can ever mess with you again. I don't want anybody to be able to mess with you in your doctor's office, in your family, on Facebook, wherever. I want you to be able to be so knowledgeable, so informed, so confident that you can take any question, that you can take any criticism and walk right through this. And boy, let me tell you, it's been a week. Hi, Monica. Hello, Erin. Hi, Catherine. Yeah, technology gremlins at work. Oh, hey, BTE, thank you for telling me that. BTE says, just letting you know that being able to see your face actually helps a lot more than you think. I believe that. I totally believe that. Thank you. It's trying to find the right way to do this is really hard. Hi, Betsa. Hi, Pauline. Hi, Sarah. Hi, JKA. JKA. Aaron says, can we talk about IC with depression and anxiety? Yeah, girl, let's do it. Hi, Heather. Hi, Lisa. Hi, Cheryl. Hi, Brandy. Hi, Sue. Okay, so I don't know how much I need to repeat, but I'm going to repeat a lot of it anyway, since our friends on YouTube haven't had an opportunity to see what we discussed. So again, the way we do these meetings is we do 30 minutes of educational content. Then I will usually take questions for about 2 hours, and then we will have a giveaway. And the giveaway for today may be a t-shirt, or it may be a mug. We'll see. Let's just see how it goes, shall we? I am open to the possibilities. I'm open to the possibilities today. We've got 10 days left of IC Awareness Month. 10 freaking days. What have you done for IC Awareness Month? Have you done anything for IC Awareness Month? If you haven't, I need you to, because I can't do it all. I won't do it all. It's impossible. If you go on over to icawareness.org, you can see all the things that you can do. You can, as an example, send our press release to your local paper. You can share your story, which we publish. We will publish all the stories we get later this fall. You can nominate your doctor for Doctor of the Year, Nurse of the Year, Physical Therapist of the Year. If you've got a support group that's not listed in our support group listings, you can add that support group. It's all about us working together. We are stronger when we work together. We need you. I need you. We need each other. We are in this together, my friends. We are absolutely in this together. And for fun, would you please make some posters and send them in, and you could win a $100 gift certificate, or a $50 gift certificate, or a $25 gift certificate. We also need some funny memes. So you can go read about that all on our website. It shows you how to do it. Go over to icawareness.org. Okay. Okay. So Aaron wants to talk about anxiety and depression. So I'm going to blow your mind here a little bit. I mean, we have always known, and let me just introduce myself. So my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I've been a support group leader for 25 years. I am, in fact, the national IC support group leader now. I have 3 degrees. I've got a degree in chemistry. I've got a degree in pharmacology, drug development. I've got a master's degree in psychology, and I could not do my PhD because I could not drive in a car to go to school. The IC network was my doctoral dissertation proposal in how to bring support to somebody who was homebound, to an IC patient who is homebound. And I'm really thrilled that 25 years later, the IC network continues to be the top rated website on IC in peer reviewed studies by Harvard Medical School and the University of London. It's it's an interesting job. It's a very interesting job because 1/3 of my time is with you, as it should be. 1/3 of my time I would like to be with clinicians who are struggling to care for IC patients. I got a fabulous conversation with a urogynecologist down in Texas last week. You know, where we're trying to get them to stop treating IC out of a textbook with Elmeron. We're trying to get them to focus on subtyping and all that sort of stuff. And then 1/3 of my time, ideally, is with research and supporting the research community. And so over on the IC network, we do a lot of surveys. Our biggest survey right now is a massive survey on the role of Elmeron and eye disease. We have over 1,200 patients now who have taken that survey. Our data is so strong that Phil Hanna, the chairman of the IC committee at the American Urology Association, who's a professor at Stanford, asked me to send it to the FDA. We sent it to the FDA. We have requested that the FDA change the labeling of Elmeron to warn patients about the eye issues. So it's a really interesting balance, right? I mean, research, I'm very research focused, I'm very clinician focused, but most of all, I am patient focused with you because I am a patient too. Hi, Gabby from Mexico. Welcome. It's nice to see you. Catherine says, time for an honorary PhD. Yeah, baby. I also have a presidential fellowship, by the way, too. I got a presidential fellowship when I got my master's degree. And so that's a very rare honor where 2 graduate students in every state are given a fellowship by the White House. So that's something I'm very, very proud of. Okay, so when I do these meetings, what you're going to find is a lot of discussion about science that you might not be aware of. So let's get back to that question about anxiety. So we have long known in almost every major research study with IC that anxiety is a very strongly related condition. And of course, that makes sense because if you're in pain and you don't know why you're in pain, of course you're going to be anxious. Of course you're going to be anxious. However, however, when we look at the subtyping and we look at so we've got 5 core subtypes that I just went through in a slideshow in our earlier meeting today. So we got 5 core subtypes. So we got number 1, Hunner's lesions. Number 2, bladder wall driven. Number 3, pelvic floor driven. Number 4, neurologically or pudendal neuralgia, a nerve compression. Number 5, central sensitization. That's my subtype, right? So I have had anxiety disorder since I was a kid. Absolutely, 100%. 100%. Because I grew up in a neighborhood where one of the other kids in my neighborhood became a rapist and murderer, and he raped and murdered my neighbor. And I spent years, a whole group of us, whenever we do our high school reunions, we have reunions. We have a victim survivors group because many of us, probably 50 people, if not more, were really badly traumatized by this guy who ended up raping and murdering people. And we knew he was bad and he loved to mess with everybody. And I got to the point where I was afraid to go to school. And then elementary school, there wasn't a day in elementary school after 4th grade that I wasn't afraid to go to school and walk to school and walk home from school. And then in junior high, your life is forever changed when you go through something like that. It is forever changed. Um, and I think that that's such a tragedy. Especially here, we've got, in my high school class reunion, I've got bank presidents who were a victim, just like I was a victim of this guy. All right. So I will tell you that I have lived with anxiety since fourth grade. High school was fine. Although it's very hard for me to trust, obviously, because some of his friends were still in school. I can't. Well, I almost ran into one of them, and I was going to chew him out. As a matter of fact, um, college. It was when I was in college that I got the word that he had raped and murdered my neighbor, and of course, I immediately thought that could have been me. So that brought all of it back. And I had no coping mechanism at all. I had no freaking clue how to deal with this. And it wasn't until after I was diagnosed with IC that I was starting to have panic attacks going to the doctor. And I think that that's reasonable because for some of us, going to the doctor is very painful. And who the hell wants to be hurt going to the doctor, right? So I bet some of you in here are afraid to go to the doctor, just like I was. But then I knew I had to go to the doctor. I would just have a meltdown beforehand. I'd be crying beforehand. I'd make myself sick to my stomach. Um, and one day I was done. I needed to get through this. I needed help with my anxiety. And guys, come on, master's degree in psychology, and I've talked about my anxiety to a lot of people, but I didn't have skills. I did not have skills until I took this fabulous anxiety management class that was taught by my local hospital. It was called Phobeas. 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 And it presented anxiety disorder in a very different way because it said that some of us are exquisitely sensitive to chemicals. Hello, subtype 5 central sensitization, right? I'm super sensitive to chemicals on the outside, but guess what? You can be sensitive to chemicals on the inside that your body makes too, specifically adrenaline. Adrenaline. So, this class, Phobeas, was taught by a surgeon with anxiety disorder, and his son had anxiety disorder. Imagine having a surgeon with anxiety disorder in the OR. That's what this guy was. And he explained that for a lot of us, runaway anxiety is really about runaway adrenaline. And he said the way to control your anxiety is to control your adrenaline. Okay, so think about it this way. And I'm going to tell you right now, I have not had a panic attack since I took the class. Okay, so if we went back 10,000 years and something startled you, a saber-toothed tiger, we have the fight or flight response. You are wired to protect yourself. You are either going to run or fight. So you hear a roar, you turn that way, you see the saber-toothed tiger, and you run like mad or you hide. Biochemically, that is driven by adrenaline. That is driven by adrenaline. And back then, the adrenaline lasted for the duration until you were safe. Unfortunately, today, in today's modern day life, we have a lot of saber-tooth tigers. We have saber-tooth tigers in our life every day. Right here on Facebook, we got saber-tooth tigers. On TV, there are a lot of things which either consciously or subconsciously trigger that fight or flight response. And so you get online, you read some stuff, you hear, the birds are dying, the butterflies are dying, you're getting poisoned by whatever. Everything you read will give you a shot of adrenaline. And it's cumulative. So adrenaline after adrenaline after adrenaline after adrenaline. Pretty soon you are swimming with adrenaline in your bloodstream. And it's the adrenaline that's driving the rapid heart rate. It is the adrenaline which is making you sweat and perspire. It is the adrenaline that is making you super, super nauseous. And so, what this guy said is the secret to managing anxiety is actually to manage adrenaline. When you control the adrenaline levels in your body, the anxiety drops dramatically. And I am living proof of that. So, how do you do it? Well, and so here's the other reality. The other reality is that if you're honest with yourself, if I ask you, do you have negative thoughts every day? Like, hey, if I say, hey, y'all want to go on a cruise dedicated to Icy? Some of you are going to go, hell no. No, I have no interest in going on a cruise. I can't even get out of the house. Right? Or if a friend calls and says, hey, let's go to a movie, you're going to go, no, I have no interest in going to see Downton Abbey. I'd love to go see the movie, but I don't want to have to get up and go to the bathroom. Or somebody asks you on a date and you're like, nope, I don't want to do it because I can't eat food. Right? People with anxiety disorder have a constant negative, what's the right word for it? Script over and over and over. Where if somebody asks you something, we don't look at the positive, we look at the negative. And when you look at the negative, every single time you do that, you give yourself a shot of adrenaline. Um, so, and I know this is sounding crazy, but this comes straight from this fabulous anxiety management class. So, how do you control adrenaline? We have to control the negative thoughts. So, how do we do that? Every single time you have a negative thought, I need you to close your eyes and visualize a stop sign. Just for the moment, just stop your brain. Like, I'm not thinking about anything right now. Stop sign. Okay. Then, nice, slow, deep breath in for 3, out for 3. Okay. That one deep breath turns off the adrenaline from that one negative thought. Oxygen renders adrenaline chemically neutral. So, stop sign, deep breath in, out. And then the third step is you got to have something that you say to yourself to kind of put it in context. And so, like, I was the queen for 15 years of saying no to just about everything. It's like, no, no. You want to go to Marine World? No. You want to go to Disneyland? No. You want to go to the movies? No. You want to go on a date? No. Hey man, that's what having IC and IBS can do to you. It's very easy to say no. What I say to myself now is, oh my God, Jill, you're not God. You can't predict the future. For all you know, that's going to be the best freaking trip you've ever had in your life. Or, oh my God, Jill, it's just your imagination. It has no power. Right? Stop sign, stop sign, deep breath, minimize the thought. Okay, now, yeah, you gotta understand that there were 50 people in this class that I took. And they're like all going, yeah, right, right, sure. And they went, listen, we want you to try it for 24 hours, try it. Every single time you have a negative thought, do it. Now, and they said, you're going to do it 100 times in the first 24 hours because you have no freaking idea how many thoughts of yours are negative. And that's all driven by an excess of adrenaline. You're not, I'm a very optimistic person. My magazine is called The Freaking IC Optimist. But it was all the adrenaline going through my body that was triggering the negative thoughts. All right. So what they said is you're going to do this 100 times. Do it because our goal is to render adrenaline chemically neutral. And so he was right. I probably did it 100, maybe even 200 times first 24 hours. I had no freaking clue that literally every thought going through my brain was negative. But then the next day, did it half as much. Day after that, half as much again. By the end of the week, I was doing it once a day. And I have not had a panic attack since I took that class. I did not have a panic attack on the way for an emergency hysterectomy for cancer because I was doing that in the freaking car. So understand that anxiety management is not about necessarily going back into your childhood and figuring out what the hell happened to you to make you go so afraid. Although, if you had something happen to you, like what happened to me, that's important to deal with. But sometimes anxiety is really just a completely normal reaction to a stressful situation. Our challenge here is it just persists and it gets worse. The more adrenaline you've got in your body, the more intense your anxiety symptoms are. So, learning that basic skill is really, really important. Um, and one of the things I really liked about the class that I took is he said, I bet you all think that the way you're going to control anxiety is go to therapy and psychoanalyze yourself. And he said, no, absolutely not. This is about real life day to day skills. And our goal here is to get you to respond when you're feeling anxious, so you don't let that adrenaline get out of control. And so the class was called Phobies, like phobia, PHOB, and then EASE, Phobies. And if you will run it, I mean, it's an old program, and I think the doctor died, and I think the program might have died with him. Kaiser is using a variant of that program now, but you might even be able to find some of his old program materials. I think I have one on. I gotta find. I will tell you that single anxiety management class changed my life. And I deal with some pretty scary things now. And it is central to my coping. Is to, as soon as I feel myself having a negative thought, I know exactly what to do. I'm going to render that chemical neutral. So, Aaron, I hope that helped a little bit. It's about skill building. And it's more than just buying a book. When you walk into an anxiety management class, one of the cool things about walking in, it's kind of like when going to a support group meeting for the first time. Before you go, if you've never been to an in-person support group meeting, it's mind-blowing to walk into a room of people who are normal. Because on the inside, we feel damaged. We can feel like we're damaged goods. We can feel like we're unworthy. We feel intrinsically that not only is there something wrong with our bladder, there can be something wrong with us, that we're being punished in some way. That's all internal dialogue that many patients have. But when you actually walk into a support group meeting for the first time and you see this beautiful group of faces of people who are struggling just like you, and they're not bad people, just like you're not a bad person. We're just hurt. Hello, Miriam from Germany. Welcome. Hello, Paula from Wales. Welcome. All right. So, you guys just know that Facebook, YouTube, if I'm looking up here, Facebook, I'm looking down here, it's YouTube. Pauline, my email address is icnetwork@mac.com. So icnetwork@mac.com. So you guys on Facebook, just know that there are times when it allows me to scroll back and sometimes it doesn't. Brandy says, shared her story for the first time publicly on Facebook. Brandy, I'm so freaking proud of you. Awesome. There's no reason for us to hide in the shadows. None at all. Hello, Marion from Ireland. Welcome. Marion, I follow on my Twitter feed some sheep farmers from Ireland and some agriculture businesses on Ireland and environmental businesses on Ireland. I love them. Zwartbles, Zwartbles. If I could share my screen, I would show some of her videos. They're amazing. They make me very happy. Hello, Pamela from Virginia. Amy says, "Has anybody ever been told that some of this can be linked to Agent Orange?" So Amy, IC was first discovered in the mid 1800s, well before we had Agent Orange. Lesions in the bladder, ulcers in the bladder, were visualized around 1920. We had our first research around 1945, and I don't think that Agent Orange was used until Vietnam, although I might be wrong. And of course, they had mustard gas in World War One. But that said, when we go back to the subtypes of IC and we look at IC subtype 2 bladder wall driven, there is a chemical injury component to this, whether it's from chemotherapy or ketamine or other toxic chemicals. There is a case to be made that perhaps Agent Orange could be irritating to the bladder and damage the bladder. I sat on the U.S. Army IC research panel for a decade, and part of that research was about the wellness of not only active duty but veteran patients, and it never came up. It never came up in any of those studies, I will tell you. Hi, Angie. Hi, Angela. JKA says, "You have severe anxiety about your bladder. It consumes me." Okay, so here's another important wellness tip. Number one, get the hell off of the internet. Stop reading about it, because the more you read about it, the worse it's going to get. Listen, you know, it's kind of like let's see, how do I want to say this? Think about those people who are angry all the time, like all day, every day. They're just angry. They're just waiting to pick a fight, whether it's online or in person. We all know people who have long-term anger issues. And we used to sell a really good book about controlling anger. And one of the things that it said is schedule your anger. It's okay to be angry, not all day. You completely waste your day if you're angry all day. So pick a time. You're going to be angry from 7 a.m. to 8 a.m. Use it. Do it when nobody's around. If you need to scream, scream. If you need to hit pillows, pillows. Schedule it. I'm going to be angry from 7 to 8. I used to do that when I don't struggle with anger that much anymore. When I would go work out, I would do a chakra color thing. So I would do 10 laps of red, 10 laps of orange, 10 laps of yellow, 10 laps of green, 10 laps of blue, 10 laps of turquoise, and 10 laps of purple. And red is the color of anger. And so when I was doing those 10 laps of red, I hit the water really hard. My goal was to just get it out of my freaking body. And you kind of have to do the same thing in a way. I think it's important that you do the same thing. It's like, okay, if you could in the morning write 3 pages longhand in a journal, and just express your anxiety. Just get it out on paper. The goal is to feed it off of your body, get it out of your body. And then once you're done with those 3 pages, you are free for the rest of the day. You focus on other things for the rest of the day. And then at the end of the night, before you go to bed, write 3 pages longhand again to get any anxiety that accumulated you during the day. Get it out on paper. This is about getting out of your body, expressing it. When you're journaling, and I recommend journaling, I did a lot of journaling early on, you don't reread it. This is not about you rereading and psychoanalyzing what you've written a week later. We don't care what you've written. You burn it. You burn it. Because the point is that you're just getting it out. You're just getting it out of your body. You're expressing it in some way. So express your anger in words. I have my journals. And let me tell you, I let doctors have it in my journals, and I let family members have it in my journals. You know, rather than taking it out on them verbally, I just wrote it down and let it go. Here, Donna says, where did Donna? Donna says, sometimes we set ourselves up for failure with our negative thoughts. Our positive thoughts should outweigh our negative thoughts. That is so incredibly true. And expression is a form of cleansing. Getting it out of you is important. Really, really, really important. I've worked with some patients who it's like they're spinning in a circle. They're just stuck in anxiety, and they can't stop themselves so that they can make a step forward. And journaling will do that. Sometimes you just got to stop and say, okay, what can I do right now to feel better? What can I do to get an answer to my question? And kind of moving that. Hello, Lisa. Yeah, Lisa, we were doing a test earlier with some streaming software, and it worked for about 40 minutes before it failed. Hello, Billy. Angela, I'm worried about menopause. Angela, don't be worried about menopause. Millions of women have done this successfully. You're going to do this successfully. But information is power. You gotta learn what to expect. And it's not like, especially my generation, it's my mom had no problems with menopause. She just sailed through it. It's like, what? I, on the other hand, definitely felt a bit from menopause. Okay, seriously, go get this book, The Vagina Bible by Dr. Jen Gunter. It has a whole section on menopause and what to expect with your skin and how to deal with the symptoms if you're having symptoms and how to protect yourself. Information is power. Go get the book. It's fabulous. This is required reading now. I want to sell it. I want to sell it in our store. We don't sell it in our store, but I just think this has got to be. Do you remember, for those of us who are older, 20 years ago, we had the book Our Body Ourselves. This is the new Our Body Ourselves. This is a new book for women who are struggling with issues down below, whether it's related to pregnancy or puberty or menopause. Get it. Don't be afraid. We're all going to do it together. And if I'm bouncing around a lot, it's just because I'm sitting on my yoga ball right now. Listen, if there's one thing you can take to town, it's the body's ability to repair itself. I say this to patients every single day. The human body is wired to fix itself. If you fell and skinned your knee, you'd have a scab on it tomorrow. So if you've got a direct bladder wall injury, you can take confidence in the fact that your body is trying to fix it. But our challenge is you've got to create an environment that will support healing. And again, it all depends upon your subtype and what variant you have. Brandy says she's afraid to go to the OBGYN and urologist to get exams. I was too, hun, but I knew I needed help. And I have it right here. Hold on a sec. Where is it? Okay. So the other thing that when I was going through that period when my IC was first diagnosed and everything hurt so badly, and I felt like every time I went to the doctor, I was hurt. I didn't want to go back either. I totally get that. And just know that the American Urology Association guidelines for IC address that directly. They understand that 20 years ago, we were traumatized by our urology appointments. And the whole intent of the AUA guidelines is to reduce trauma and reduce harm and make you feel like you can trust your doctors more, right? But 20 years ago, we didn't have those. So the other thing that I did is rather than go into the doctor's office or hours before, focus on how bad it was going to be, I decided that I was going to focus on how good it was going to be. And one of the techniques that you can use is you rehearse it in your mind. It's like you literally, I was doing this before my hysterectomy, you visualize a good night's sleep, an easy trip to the doctor's office, The receptionist is smiling. They call you in quickly. The nurse is very kind to you, or the PA is very kind to you. The doctor comes in, treats you with respect, treats you with kindness. You get what needs to get done, and you have a fantastic visit, right? If you rehearse that in your brain ahead of time, rather than going, he's going to treat me like garbage again. You got to set your goals high, right? Don't set your goals low, set them high. We don't want to do a self-fulfilling prophecy. But anyway, one of the other things that I did is I carried around this, and this is actually what I carried around. And on each page is an affirmation. And so I would, as I was sitting in the doctor's office for whatever was going on, I would just go through this and I would repeat these to myself. So and so these are the ones that I use. You've got to find the ones that are personally meaningful to you. But my first one was, I can do all things through Christ who strengthens me. Okay. And again, you pick your own. If you don't want religious ones, that's fine. But I can do all things through faith. Okay. That helped my self confidence. When a big trouble comes along, you have to pray big prayers. Learn to pray big prayers. If you have faith, nothing shall be impossible to you. That was that one. And I colored them too, because I'm very color focused. Attitudes are more important than facts. Okay, so like literally any fact facing us, however difficult, even seemingly hopeless, is not so important as our attitude towards that fact. If you feel you are defeated and have lost confidence in your ability to win, sit down and make a list of the factors not against you, but for you. I was doing that with a patient the other day. She's like, well, she said, I have nothing. Nobody cares about me. And I went, okay, let's make a list. I went, are you married? She goes, yeah. So does your husband love you? Yeah. Does he go with you to your appointments? Yeah. Girl, I don't have that. You've got something that I don't have. You've got a loving partner. That is a good thing, but sometimes we get consumed by all the negatives that we forget the positive. This is one of my favorite ones. Be bold, and mighty forces shall come to thy aid. Be bold. Be bold. Don't let anybody stop you. Do the thing you fear, and the death of fear is certain. I mean, I have to say, I'm not afraid to go to the doctor anymore. That's for sure. Formulate and stamp indelibly on your mind a mental picture of yourself succeeding. Hold this picture tenaciously. Never permit it to fade, and your mind will seek to develop it. When a negative thought comes to mind, deliberately voice a positive thought to cancel it out. Right? So, I carried this for about 5 years. And I have them memorized now, and so I don't need to carry it with me anymore. But just having something like this that you can read through that strengthens you. You're not reading about how bad everything's going to be. You're giving yourself faith and confidence and strength and courage. So do that, okay? I mean, seriously, you can go get a little spiral notepad, fill it up with encouraging things. Carry it with you, read it. All right. Cheryl says, I may have to leave the meeting this morning. I tweaked my back, put myself in a horrible flare. I'm so sorry, hon. I'm telling you, life, right? Erin says she had numerous traumatic events in her life, like I did. Getting IC was traumatic also. I agree. And that it triggered PTSD. Yeah, completely. I get that. Melissa says, I'm extremely sensitive to smells and noises. I feel like I feel the noise like a lawnmower. So Melissa, that puts you strongly in the central sensitization group, like me. You're not alone. Isn't it weird? It's so weird that, one of the first questions I ask patients when they call is, do you have a wicked sense of smell? And they go, yeah. How do you know that? And I went, oh, well, so do I. And they go, what? Debbie says, I have a very sensitive sniffer. I smell things others don't smell. Back in 1992, 1993, there were actually researchers at UC Berkeley that were exploring this really wicked sense of smell in IC patients. And that's one of the things that really turned us on to this whole thing, which we now call central sensitization. But in my local groups, when we asked people, at least half the people in the group had this really wicked sense of smell, and also the itchy skin. And it's not related to IC, it's really your anatomy, hun. Central sensitization means that you were born with more sensitive nerves. It's not a disease. You don't worry about it like a disease. It is hardwired into your genetics, into your body, usually a gift of your ancestors. Remember that 5,000 years ago, 10,000 years ago, tribes needed people who were sensitive because they could find the food, they could smell the food, they could smell the water, they could smell bad water. Sensitivity is an evolutionary priority. Um, Especially, for my family in northern Norway and Sweden, we needed to be sensitive to find food and to smell food. So I don't look at it. It's a gift. It's a gift. It's not a bad thing. But it's annoying in 2019. The odds are you've already cleaned up your life. You don't have chemicals in your home. Oh, and by the way, I got the Echo eggs, because we're exquisitely sensitive to soaps and laundry detergents and things like that. For those of you who were at our support group meeting a couple weeks ago, I demonstrated the Echo egg, which is a new way of washing your laundry without any chemicals in it. And it's fabulous, absolutely fabulous. I'll go get it again if you want. If I could screen share it, show it to you. Sherry, phobies, you have the spelling right. Just put an E on the end. Hello, David. Hello, Carolyn. Hello, Marion. Hi, Libby. Hi, Henriette. Hi, Rachel. Pamela says, I feel like my family doesn't understand the pain and depression I feel. I'm 66 years old and my IC is getting so much worse. So Pamela, the odds are the reason why you're getting worse is probably the loss of estrogen, because your bladder relies on estrogen to produce that nice thick mucosal barrier in your bladder, that nice thick protective coating. So you are undoubtedly in the middle of what we call the genitourinary syndrome of menopause. And so without that nice thick coating, your bladder is going to be much more vulnerable and sensitive. And so you've got to really protect your bladder more. No multivitamins, no coffees, no green teas, no black teas, stuff like that. You might be using a topical estrogen product, which would deliver some estrogen to your bladder so that your bladder can produce its own mucus. Um, um, and then ultimately, you might find that you might benefit from a product or a treatment that would protect your bladder even more. Used to be Elmeron. Of course, we don't recommend Elmeron anymore because of the eye issues, but you could try. Okay, so in terms of over-the-counter products, you could try, whoops, Desert Harvest Aloe, which is very calming and soothing to the bladder. And I will tell you, Pamela, that Desert Harvest also makes an aloe gel with lidocaine in it called Relivium that you can put on your vulva if you're struggling with urine burn from your vulva. Anytime your vulva gets dry, what happens is urine, as you pee, it crosses your vulva and it tends to burn those tissues. And so we call that urine burn. And that is most likely just due to estrogen atrophy. Here, hold on a sec. I got to get comfortable here. All right, that's more comfortable. Stay. Okay. You could try Bladder Builder. Bladder Builder contains chondroitin and hyaluronate, which have a coating effect. It also has some probiotics in it, which might be helpful for maintaining your biome, collagen from your bladder wall, and PEA, palmitoethanolamide, which is known in multiple research studies to reduce chronic pain, specifically neuropathic pain. So this has a bladder protective effect combined with perhaps a pain reduction effect. Of course, it doesn't work for everybody, but it might be worth trying if you want to give it a shot. We've got bladder rest, which is a basic bladder coating with chondroitin and hyaluronate. And we've got Sister Renew, which is kind of like bladder rest with aloe in it. So that would be something. But then also, hun, depression can also be triggered by menopause and the loss of estrogen. And anybody out there who's struggling with depression, would you please let your doctor know so that they can maybe test your estrogen levels, maybe do a few other things that might be helpful to you. One of the first symptoms that I experienced of menopause when I was perimenopause, when I was like 46 or 47, was free floating anxiety. I just wake up anxious. It's like, what the hell? Why am I anxious? And of course, it's like, I have no idea why I was anxious. And or feeling depressed or feeling frustrated or learning new software, where in the old days I could spend hours doing it, but after menopause, holy hell, if I can't figure it out in 15 minutes, I want to throw this freaking computer through the window. My attention span is lower now with menopause. So Melissa says, so if you're diagnosed with things like IC, fibro, and IBS, what's next? I have seen specialists for all of them. I feel like I get a diagnosis and the doctors are done. I have extremely bad allergies, so I feel that this is my major issue. How do you get them to help you? Melissa, it's going to be a divide and conquer strategy here because there's no doctor that specializes in all of them. So if you've got wicked allergies, you've got and we know that patients will flare during allergy season. That's very commonly known. So it may be that one reason why your other things, your bladder and your bowel are struggling is because your allergies are out of control. So working with an allergist to try to figure out what you're allergic to, and then using medications if necessary to help control those allergies might help your bladder and bowel tremendously, especially your bladder. This was brought up 2 years ago at the American Urology Association in the IC class. They also recommended during allergy season that IC patients, in addition to using the antihistamines, use Montelukast, especially for patients with asthma. So Monte, Monte, Lukast, Lukast. So divide and conquer, hun. Listen, I didn't get my IBS under control until I went and worked with an IBS specialist. And that single appointment with that IBS specialist was the best medical appointment of my life. And so if the IBS is out of control, work with a gastroenterologist. If your IC is out of control, work with the IC. But ultimately, in the end, the foundation is they're all probably being exacerbated by your allergies to some degree. Erin says, that's me spinning all the time. Yeah, girl, we gotta. So the way you stop spinning is you gotta give it a voice. Start writing it out. Debbie says, Jill, is IC an autoimmune disease? Okay, so again, look at the subtyping. IC subtype 1 Hunter's lesions. Could we say that that's an autoimmune disease? Well, there are multiple opinions on that. some people, because of biopsy results for Hunner's lesions, what they find is really, really significant inflammation and an inflammatory process in lesions. Some have suggested perhaps that there might be an autoimmune component to it. But of course, now we also know that Hunner's lesions can be linked to just a simple viral infection. Um, the last time I researched it, there were 4 critical tests that had to be met for something to be considered an autoimmune disease, and we only met 2 out of the 4, and that was only a small population of patients, okay? So I don't think we can make a blanket statement that everybody with IC has an autoimmune disease. I mean, chemotherapy patients do not have an autoimmune disease. Pelvic floor injury patients do not have an autoimmune disease. Brandy says, speaking of menopause, is estrogen recommended to help your symptoms? If you're in menopause, it could be, yes. If your symptoms are being driven because you have dry skin, you have a dry vulva, a dry urethra, a dry bladder, then using topical estrogen could help dramatically, because topical estrogen, there are amazing pictures and studies showing how skin changes for the better with topical estrogen. Oral estrogen, on the other hand, is dangerous. Oral estrogen, it delivers estrogen throughout your body. I was working with a patient on Friday who took oral estrogen for 30 years and ended up with breast cancer. I took oral estrogen for 5 years and ended up with early uterine cancer. So doing oral estrogens is much more dangerous than doing a topical estrogen, where the medication tends to stay in those tissues. And multiple research studies have now suggested that topical estrogen is a far, far safer way of using estrogen. Mindy says, I'm having a different type of flare. It's lower in my urethra. If I move, it's so bad. Has anybody had? Okay. Okay. That's interesting. So Mindy, I wish that I could scroll forward. Let me just tell you, I have a very good blog on our website called The 7 Causes of Urethral Pain. And I want you to go over to the IC Network, icnetwork.org, and search for that article, The 7 Causes of Urethral Pain. It could be something very, very simple, or it could be perhaps an infection of the periurethral gland halfway up the urethra, and it could be estrogen atrophy in the bottom half of the urethra. The interesting thing, though, is that movement is triggering it. And that's the part that is catching my attention here, because the normal triggers of urethral pain wouldn't be driven by movement. And so I also have to wonder if you've got, really, really, really tight muscles that could be squeezing the nerves near your urethra. I think that that's possible also. Brandy said, I had a urologist do a bladder biopsy in his office with no anesthesia. He just told me it would be bad. He told me it wouldn't be bad, just a pinch. The pain was horrible. I wish I would have known before. Yeah, girl, that's why it's so important that when people are going to have testing, they come and read about it on our website first. Um, and God forbid he did a hydrodistension at the same time, which normally they have to do a biopsy. I'm so sorry that you went through that. It sucks. When you're under anesthesia, it doesn't hurt. Dominica says, any recommendations for a doctor in New York? Yes, Robert Moldwin out on Long Island, the author of the IC Survival Guide. He's dedicated his entire career to IC and female pelvic pain. He's a fabulous man, one of the nicest guys you would ever meet. Robert Moldwin, like mold on bread and win a race. He is the author of this book. So some of your old timers, you probably all have this book, the IC Survival Guide. by Robert Moldwin. Don't buy it now. It's out of date. It's like 15 years old. But it's, it was what we had. It was our IC Bible back then. And the newer book that he wrote is this book, Urologic, Gynecologic, and Chronic Pelvic Pain. He's the editor of this book, and this was just a couple of years ago. And this is really a clinical primer. This is less about research and more about how should we work with patients. And so it's quite good. It's quite good. And some of the best doctors and clinicians and patient activists in the world are in this. So as an example, Chapter 1, the evolution of therapy for chronic pelvic pain. Chapter 2, the role of organized patient support. Chapter 3, psychosocial management of urologic chronic pelvic pain. That's very important. Advanced nursing care, diet therapy, acupuncture, phytotherapy, the use of tricyclic depressants, bladder surface mucin analogs, neuroleptics, antiallergics, opioids, hormonal therapy, non-surgical, nerve blocks, intravesical therapy, intravesical lidocaine, Botox, neuromodulation, cystectomy. This book will cost you $200 because it's for doctors. But urologic and gynecologic chronic pelvic pain is the most current clinical care provider book for IC. And I'm just wondering here for a moment. Let me look at something here a moment. Yep. Okay. I'd like to take a moment and thank our sponsor. Oh, hold on one sec. This support group meeting would not be happening without the support of DSC Healthcare. Oh my God. DSC Healthcare Solutions, who now owns Preleaf. This was originally developed by Alan Kligerman, and he's the guy who invented Beano and a couple lactate, a couple other things like that. He's now in his late 90s, and he sold Preleaf to this new company a couple years ago. I will tell you, Preleaf has been with the IC movement from day one. Every single patient organization has benefited from their sponsorship. They have sponsored every IC event that has ever happened. We have worked with them for 25 years, incredibly grateful for their support and encouragement. And it is considered the most trusted over-the-counter supplement, reliable over-the-counter supplement out there. It doesn't treat the bladder. What it does do is reduce acid so that your urine is not irritating any wounds that might be in your bladder. So if you're going to grandma's house with the upcoming holiday season, you know she's going to make lasagna. You know you can't avoid it, and you don't want to let her down or disappoint her. So what do? You take a couple of Preleaf right before, and that could render the acid in the tomato sauce less. So you can get that in our shop. You can go to preleaf.com. I really love this company. They have put their money where their mouth is to really help this patient community, and we're very, very grateful. Tricia says, can you speak a little bit on the topic of ICM relationships? Sure. So let me start by telling you the story of Joanne and Chuck. And they have both passed away, so I can tell you their story. So Joanne and Chuck were in my support group, my local support group, and Joanne had IC. Chuck was her husband, and they were in their 50s when I first met them. And they were, she was pretty prickly. She was, she tended to be pretty prickly in meetings. And she was obviously suffering. And she was kind of hard to be around, to be quite honest. She wasn't exactly a warm fuzzy. She tended to be a little bit more of a cold prickly. And I went to their house. I ended up building a website for them, for their business years and years ago, like 25 years ago. So I got to know them really, 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 really well. And they became very, very good friends. So we had a Christmas party in our local support group. And um uh they got into the biggest fight. I have never had a a family fight, and they were cats and dogs, and they were both crying. And what she ended up just saying is, "You don't love me. You won't even give me a hug." And he said, "Honey, whenever I try to give you a hug, you push me away. The last thing I want to do is hurt you." And she was like, "But you should know when I need a hug." And he's like, "I don't know when you need a hug, and whenever I try, you push me away." Bam. And it was one of the most important messages for our local group because so, they both thankfully I'm pretty good on my toes, and I got them separated, and we started calmly talking to both of them. And I said to her, I said, "Joanne, do you really expect Chuck to read your mind and know when you need a hug?" She said, "Yeah." And I went, "That's not fair. That's not fair. You're making him guess. If you need a hug, you need to ask for a hug, or better yet, walk up and hug him, because no one can read your mind. No one." And what we didn't know is that she had Lewy body dementia, because she very quickly after that, she had the same dementia that Robin Williams had, and that eventually killed her. And I will tell you that he stuck by her to the bitter end when she was, you know, out of her mind with Lewy body dementia. The love in that man's heart for his wife was undeniable. He brought her to support group meetings. But the kernel of the lesson is so important here. It is that relationships thrive on communication. If you need something, don't expect them to guess. You've got to ask for it. If you need help doing the laundry, ask for it. If you can't do the laundry, tell them you can't do the laundry. If you can't do something, or if you have a doctor's appointment and you need help getting to the doctor's appointment, seriously, do not sit in your room and go, "Well, he should know I need to go, or she should know I need to go." And guys, this isn't just about heterosexual relationships, this is every relationship. It doesn't matter. It doesn't matter. So, concept number one for good relationships with IC is be honest and willing to talk to each other about how you feel. Now, the second thing that we have to consider, though, is the concept of intimacy, because relationships are meant to be an intimate joining of two people who love and care for each other. And that's really hard to do when you've got a screaming prostate or a screaming bladder. And some of you out there, um, I've seen a couple of different things happen, all of which I think are pretty tragic. So there are some partners who, when the other partner wants to have sex, they just push them away, and they just say, "No, no, get the fucking hell away from me right now." No, I mean, and I'm saying that because that's the language they use. because you don't want anybody to touch you when you're in pain. Okay, and I understand that. But the reality here is that you've got to qualify that and say, honey, I love you like I have never loved you before. I am so grateful for you. I want to be with you. I want to be with you in every possible way that I can. But right now my bladder hurts and I can't have sex right now. But that doesn't mean that you can't pleasure them. And that's important. That's important. You know, we were all sitting around the table. This was years ago, like 15 years ago. And I don't remember who it was. It was like 3 or 4 of us. And we were just talking about sex and IC. And at some point in time, somebody went, surely there's something that a couple can use when somebody can't have penetration. And we're like, yeah, you'd think, right? And so we got online and we Googled it and we found male sex toys, specifically I wish I had a demo for you. I don't. The fleshlight, not flashlight, fleshlight. It looks like a flashlight. You could have it on your bedside table. Your mother-in-law would never know it's a sex toy. And what it is a hollow tube filled with ridges and stuff to mimic the inside of a human body. And you can put that between your legs and your partner can thrust into that. Or you can hold it, or you can do things like that. And so being willing to try different things is fairly important. It's fairly important. Pleasuring your partner, even if you can't have sex, is meaningful. There are some women with, and I can't even say that women and men. There are some patients who will agree to have sex even though they know it's going to hurt, and they pre-medicate with pain meds, and they don't tell their partner it's going to hurt. And I think that's a real tragedy. And then there are some who are expected to have sex regardless of how they're feeling. And those are the patients that I feel the worst for because they're basically being abused by their partner who doesn't care. And I don't even know what to say about that. That's just incredible selfishness for any partner to force their partner to have sex even though they're in pain. It's like, would you expect your partner who just broke their hip to have sex? No. Well, if you've got a screaming bladder, there's no difference between that and a broken hip with respect to pain. You know, you don't go run a marathon on a broken leg. Don't try to go run a marathon on a broken bladder. Don't try to have wild, passionate, athletic sex on a broken bladder. That's when you go for gentle, soft sex. Now, I will tell you, we've got some resources for you. You know, and I want to be really honest here. I mean, let me just be really honest here. My IC hit when I was dating Todd. Todd. He's a lovely guy. And he had watched his mother die of cancer. And he said, I can't watch you die too. And so we broke up. That was hard. That was hard because I thought I was going to marry him. But anyway, it is what it is. So there was a point I was going to make, and I just went in my brain and out. All right. So if you're having issues with intimacy, this is a book you can get on Amazon called Secret Suffering: How Women's Sexual and Pelvic Pain Affects Their Relationships. What's really cool about this book is it's got lots of success stories in it. It's got lots of, and there's tips, like 200 tips on how to make intimacy more comfortable. No, oh no, not 64 tips to relieve sexual and pelvic pain. Right? So if this is really, and there's same-sex couples, heterosexual, homosexual stories in here, all sorts of things. They explain why it hurts, all that sort of stuff. So anyway, this would be a book you could get. And then I'm pretty sure that the interstitial cystitis solution, I think it has a section on intimacy. Yeah, it does. So if you guys have this book, it would be helpful too. It's also important to know that I understand how intimacy, and when I say intimacy, I mean intercourse. And I'm sorry, I'm bouncing so much. I'm just sitting on this yoga ball. Um, Generally, a man with IC with a will have their worst pain at the moment they orgasm and they ejaculate, because that is when they have their strongest pelvic floor spasms. A woman is different. For us, our sex related flares usually start 4 to 6 hours after sex. It's really interesting. And that is because in the female body, we go through about 24 hours of subconscious muscle spasms of your pelvic floor, which I think are designed to help sperm meet egg. And so, if you flare the day after or hours after that, that's exactly what we tend to see in women. And so, using something like a vaginal Valium suppository or baclofen or Flexeril after intimacy can be really important. And of course, lots and lots of lubrication. We don't want dry skin rubbing on dry skin. You got to use a lot of lube. Over on our main website, icnetwork.org, we have a whole section on sex and intimacy if you want to go there. But ultimately, in the end, Trisha, we had a sex therapist come to our. We had two different sex therapists come to our support group meeting. Um, the first sex therapist was so interesting because he was teaching at the UC San Francisco Medical School. And Evelyn, who helped me start my group, is the one who brought that speaker in. She'd never met him personally, but had heard of him. She talked to him on the phone. We set him up for a meeting. He came to the meeting, and in walked Santa Claus. In walked, we like, oh, Santa Claus is going to come talk to our group about sex. The guy looked like Santa Claus. Long white beard, long white hair, big jiggling belly. Hysterical. Nicest guy in the world. And the first thing he said to us is he said, never, ever, 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 ever ask your doctor for sexual advice. And we're like, why? He goes, because I can promise you there's that they are as dysfunctional as anybody else. And he said, just think about their work schedule. They don't get a normal night's sleep. So don't assume that your doctor is going to be the expert on sex. They may have just as many issues as you have. He just had us rolling laughing. And he told us a story of, a couple that I'll never forget. He said, because in addition to teaching at the medical school and teaching sex and intimacy to the medical students and the residents, he saw patients. And he said, I have this couple who come to me and I don't even understand why they come to me. I mean, frankly, I am in awe of their relationship. I envy their relationship. It's clear that they love each other. They don't need my help for anything, but they still come to me. And so I'll talk to them. And we're like, okay. He goes, yeah, but there's something you need to know about this couple. And we're like, okay, what? He goes, well, he was in the war. We're like, okay, what? He goes, no, 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 no. He was in the war and he was injured. And we're like, okay. He goes, no. A landmine tore off his penis. We're like, oh my God. He asked, how could a man without a penis have a sex life that every other man in the building envies? He asked us that question, and we're like, I don't know. He goes, outer course. Outer course. That couple became a master not in inner course, but in outer course. So, what is outer course? Outer course is about getting your partner to that point right before orgasm that feels so good. And normally, it might last a minute. And in outer course, your goal is to use touching and stroking and whatever you can to get that partner to that point and keep them there for an hour. And I mean, 5 minutes would be mind blowing. An hour? That's never happened to me. Ever, 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 ever. And um, and then he said, listen, you've got a couple advantages in that. Number one, y'all feel so damn good. You could care less if there was actually penetration. Number 2, if there is penetration, it's so short, it's like 1 thrust, 2 thrusts, you're done because everybody's so incredibly aroused and they feel so good. And so he again, he brought up the very important point of how can a man without a penis have a sex life that every other man who knew him absolutely envied, and that is they showed their love through intercourse. And so learn about that. Now we had another sex therapist who came to our meeting, and she was kind of a middle, you know, a 40 something doctor. And she taught us something else that was really, really interesting. And she shared how relationships change over time. So she said, you know, when you're a teenager and you're in your 20s, it's pretty much slam bam, thank you, ma'am. The sex is very quick. You know, you get in there, you thrust, you ejaculate, you're done. And there's very little cuddling when you're 18 years old or 22 years old because it just tends to be very, very quick. And that what she said is over the years, couples change as they get older. So when you're younger, sex is pretty athletic and the cuddling is much less. But as you get older and you're in your 30s and your 40s, the cuddling becomes more important. And by the time you're in your 70s or your 80s, the cuddling is what you got. And so she said she said the true test of a couple is how you handle those moments when one of you cannot have sex. And it is important that the partner not say no so firmly that the patient in pain, if the patient in pain says no and doesn't qualify that, you're really potentially hurting that other person. You've got to say, um, I love you so much. I am not rejecting you. I love you. If I could do this, I would absolutely do this right now. But right now, my pelvis hurts and it would not be a good time for me. However, I would like to pleasure you or whatever. Okay. And as Donna says on YouTube, making love is psychological as well as physical. That is absolutely true. Absolutely true. So you'll find over on our website really good section on sex and relationships with IC. So Trisha, I hope that that kind of addressed your question. But if I missed the point and there was something else you wanted to know, just please ask it again and be a little bit more specific, and I would do my best, my friend. Christine says, I'm recently divorced and I'm wondering how I'm ever going to have a loving relationship with a man that understands my IC and doesn't pressure me to have sex. All right, Christine, girl, you do realize that the vast majority of men out there will have prostate problems probably starting in their 40s. So you're not an island here. Guys have just as many issues as women do. And it's your ability to talk about it that is going to make the difference. I personally think that uh, I would absolutely love to be with a man with a bladder or prostate or a bowel problem because we get it. We have the same diet. We understand the disappointments that happen with flares. We can be kind to each other, supportive of each other. Um, so you know, so understand that men have just as many issues as women do. You know, and any guy who's going to attempt to pressure you to have sex is certainly not somebody you want in your life anyway. Uh, and ultimately, in the end, um, as I say, you know, I mean, I think how do I want to say this? I got to think about this. There's no such thing as a fling anymore when you've had an injury. You know, I mean, I'll be really honest. I chaired our state pain conference years ago, and I'm going to tell you that DEA officer was hot, and that opportunity was there. It was there. Like it was. We were at the hotel. Could have happened. And because I was chairing the event and I knew that I'd have to be up early and that I was going to be standing in front of 500 people all day. I knew that if I had sex that night, I would not be, there was a chance that I would not be functional the next day. And so I tend to ask myself, um, is this person worth that flare? And I will tell you that very few people have ever met that standard. One has, one has. Um, uh, I hope that that makes sense. Kind of, sort of. But I'm telling you, that DEA officer was hot. He was like, the door was open, like the bedroom door was open, and I was right there looking at him, going, could have been a fantastic night, but I had to work the next day. There you go. Tanya says, with pelvic floor dysfunction, can you have rectal spasms as well as bladder spasms? Your levator ani can spasm, and your levator ani is called ani for a reason. Anus, ani, A-N-I. It tends to be around the rectum. And so when that muscle is tight, it absolutely can trigger some rectal discomfort, and as well as constipation. Bladder spasms are triggered by, but you got to understand you've got different muscle groups happening here. So the bladder is composed of smooth muscle. The rectum is composed of smooth muscle. The pelvic floor muscles are composed of skeletal muscle. They're different types of muscle. And so you could have bladder spasms. You could have rectal spasms from the smooth muscle in the rectum and in the bowel, or you can have pelvic floor spasms where the pelvic floor is just triggering rectal pain. I had levator spasms for 10 months after my hysterectomy. And yeah, I had a lot of rectal pain, but I felt like there was a hand up my vagina, grabbing on tissues and pulling downwards. That was how my levator ani spasms felt. Hello, Karina from Sweden. Hello. Lisa said, last year for September, I made a video every day and told my story. This year, I wrote my congressman, made a couple of videos. Girl, you're hitting it. Thank you. Thank you. Thank you. You could be that one person who writes the formative letter that gets that person to be the last vote to support IC research. I always say to patients, listen, if you're up all night crying in pain, don't just sit there and cry. Go turn your computer on, go get a pen, piece of paper, write it down. Write down exactly what you're feeling. Tell them how it feels. Tell them why you can't sleep. Tell them that you feel like you have a fist up your vagina, or tell them that you have searing pain when you sit down. That is the perfect time to write a letter. Describe it in depth. Gabby on YouTube says there's a girl on YouTube says that she cured her IC killing streptococcus. So she might have had IC subtype 2 chronic infection, and that is possible. But not everybody has this, and I don't want to jump down this rabbit hole during this meeting. Sleepy Bookworm says, I'm in the United Kingdom. My doctor says there's no such thing as vaginal Valium. Blunt question, do you US ladies just put a regular Valium in your vagina? Some patients do. Some doctors have them do that. But a lot of compounding pharmacies actually will make up a vaginal Valium suppository with a cream base. And I can tell you that there are a couple of products going through the FDA approval process, and I think over-the-counter products as well. And so your doctor is wrong. There is vaginal Valium. And Sleepy, if you email me, I can try to get you some supportive materials to give to him. Okay. I wonder if she has it in the Vagina Bible. Hold on. I don't know if she does. Let's see. Yeah. 303, 304. Let's see what Jen Gunter says about it. So in this book, she doesn't. She says yes, vaginal Valium is available, but she says the Valium acts at the spinal cord, and that when you use it as a suppository, it doesn't necessarily get to the spinal cord to be effective. But that said, quite a few people have used vaginal Valium very successfully. Oh my God! Hold on. Okay, I gotta change my. Hold on. We're done with that. Hold. This is what we call glute stretching. That's the hardest part for me. The hardest part for me working is sitting. So now we're going to perch on my work stool, which means I have to raise. So we'll see. I'll probably last 20 minutes on this. All right. Oh my God. This is because, guys, I am a pelvic floor patient with an SI joint dysfunction. So sitting is challenging for me. Oh my God. Okay. Rahul says, I ask you to do the duty of an elder sister and find a girl for me because I'm single. Well, man, only if you'll find a guy for me because I'm single too. But I don't know if you have IC, dude. Do you have IC? If not, I'm going to ask you to leave the meeting because this is a real support group meeting. Hello, Cher. Hello, Heather. Angela says it's exhausting to always ask your spouse for help. Literally has to be asked every time. Goddamn time. Does not occur to him to manage much. Well, it is what it is. Some people get it. Some people don't. Some people you have to lead. Some people are self-directed. You just, the personality is personality. So just if you can make a list, if you can do that. But Angela, they're not going to be able to read your mind. You gotta be kind and speak it out. Billy says, anybody having trouble viewing? And Facebook's been weird. Facebook kind of was broken earlier, so I don't know. Monica says she lost her marriage and her house because of the IC. Those are the stories which are really, to me, very stunning and so true. And they do happen. You know, when we take our marriage vows, it's in sickness and in health. And sickness can happen to anybody, whether it's cancer or IC or a broken hip. And I was working with a guy, you know, he's so amazing. You know, people kind of have these perceptions that it would be a man who would leave a woman, which is so unfair. That's not. There are wonderful, wonderful men out there who are incredible husbands. I was working with a guy who was a fairly famous politician in another country, and his wife had left him and taken their young child, and he was crying on the phone, and he said, "Who would want me?" And what she said to him is, which was stunning, she said, "You cannot support me in the lifestyle I deserve," because she liked to party. And she was a one percenter. And even though he was like the governor of a Caribbean nation. This was a long time ago. I mean, he's not there anymore. And he was working, but he was in a lot of pain, and he couldn't do the things that they normally did. And she was so cruel to him, so cruel to him, stunning. And so he said, "Who would want me?" And I said, "I would." Are you kidding? He was great on the phone. Smart, kind, intelligent, compassionate. He would have been a great catch. And I was serious. I mean, Carmen says, "How come there's organ transplant for other organs but not the bladder?" Hun, there are transplants for the bladder. In fact, we just did an article on that. So bladder transplants started probably 15 years ago, and they were first crafted. It's really interesting technology. In for children with spina bifida. And so what they did is they had healthy areas of their bladder. So what they did is they did deep tissue biopsies, and they biopsied every single layer of the bladder from inside and out. And then they grew each layer in a lab. So as an example, so they grew it out first. They grew each layer out first in the equivalent of Petri dishes. And then when they had enough tissue, they put it on a scaffold that looked like a bladder. And so they put the inside of the bladder cells on the inside of the scaffold. They put the outside on the outside. And they were able to, over this scaffold, create a completely normal bladder for these young kids with spina bifida, with the exception of blood supply. So the question is, how do you get blood supply on basically human tissue? And so what they did is they wrapped the bladder in oh, it's not undum. What's it called? You've got a network of tissue in your belly that's filled with blood supply, and the name is just not coming to me. And so what they did is they took some of this tissue and they wrapped the new bladder in it, and then they implanted it in the patients, and it worked. It worked really well, and it was done at Wake Forest University, home of Robert Evans, a top IC doctor, and he happens to be a surgeon who has worked in that. And then I think what happened is they sold off the technology to a company that then went bankrupt. So we've done articles on it in our magazine, on our website. I think we did our last update, I don't know, like 3 years ago about it. And what they're doing now with that technology, I mean, they still have the potential of growing human bladders, but what they're doing is they're growing mini bladders for research purposes, mini organs. So they got mini stomachs, mini bowels that they can use in tissue. I mean, in research studies. So I don't think a lot of bladder transplants are happening now. And I think Stacy Shannon, who writes a lot of the articles in our magazine, interviewed the researcher whose name is on the tip of my tongue. And he asked if they'd ever done it. She asked if they'd ever done it on an IC patient. The answer was no. No, but has been done successfully, creating a bladder from your own tissue so there's no organ rejection. Now, the other question is it possible to transplant the bladder from somebody else into your bladder, like from a cadaver or from somebody who has just passed away and donated their organs? And I am not aware of anybody doing that. Interesting story, though, right? I'm trying to scroll back through your questions, guys. So give me a moment here. Brandy says pre-leaf allows her to have coffee in the morning. Yeah, but hopefully, Brandy, you're using a low acid coffee. So we do have really good low acid coffees. So the best low acid coffee on the market is Bella Rosa coffee. It has the lowest levels of chlorogenic acid, which is the acid which causes stomach irritation and bladder irritation. And it tastes fabulous. Belarusian coffee is served in almost every supermarket and coffee shop here where I live in Northern California. It is hugely popular. Simpatico low acid coffee has been around for years. They have a decaf and a regular, and also Tyler's coffee. And they call themselves the world's first acid-free coffee. That isn't quite true. They don't test out at pH 7. They test out at a pH 6 point something, which means that there's a little tiny bit of acid in it. Tyler's is the first to come in a K-cup. So if you have a K-cup coffee maker, then you could try the Tyler's coffee. Monica says, does IC have a cure? Well, hun, it depends upon your subtype of IC. Do you know what your subtype is? If you are IC subtype 3 pelvic floor, that is curable. If you are IC subtype 2 chemocystitis, that could be curable. If you're IC subtype 2 genitourinary syndrome of menopause, that is aging. That's not an illness. We don't cure menopause. We try to give that skin some estrogen. If you have Hunner's lesions, we had a treatment called Lyris, which completely healed and cured Hunner's lesions. Unfortunately, Allergan currently has that, and they're not doing any research with that. So it's all about your variant of IC, hun. We have to understand your unique presentation of IC. We don't make broad statements, generalizations. A one treatment fits all approach does not work. And the reason why it does not work is because there are very clear subtypes or variants in the IC patient community. Another group of patients that have been cured are patients who have fibroids, and the fibroids that are pushing on their bladder and triggering their symptoms. So we got to understand your anatomy first. Every patient is an anatomical mystery to be solved. We have to look at bony structures. Is there is there an issue with bony structures that could be contributing to your pain? We have to look at organs, your bladder, your prostate, if you're a man, your uterus, your vagina, your ovaries, if a woman, because those can influence the bladder. We have to look at muscles because many patients, the biggest subtype of patients are patients with muscle injury. Muscle injuries are curable. They're curable. And Dr. Chris Payne, who proposed the 5 subtypes that we use, he used that in his argument. He said it was so incredibly unfair to tell patients that they have an incurable bladder disease. That is absolutely not true. There are variants of IC. Some of these variants or subtypes are curable. Julie says, I feel so discouraged. I have ulcerative colitis and my GI is recommending that your colon be removed. Your IC is flaring. My husband, oh, girl, if I could, I wish I could give you a big giant hug right now. I'm so sorry. That is brutal. Was I talking to you on the phone last week? Because I was working with a patient with ulcerative colitis. I don't know if that was you or not. You know, um, ulcerative colitis is a beast. And I have a pretty good friend who has had more, basically he has ulcerative colitis. So they had to go in and remove that section of colon that had it. And then a couple years later, it moved to a different area and they would go remove. And it's just kind of been a process of removal. Every time he's gone through the removal, he's felt much better. Actually, I have 2 guy friends who have been through that. But all I can do is tell you, you need to work with a specialist. If your case is that severe that they're talking removal, getting a second opinion is important. If you can, please go to a local university or a medical center. I don't know what state you live in, but UCLA, UC San Francisco, Stanford University on the West Coast, on the East Coast, Harvard, Yale, Tufts, or Wake Forest. You could try Wake Forest. but you need to be in the care of a specialist at this point in time. I would also be reading up and learning about fecal transplants because, you know, a lot of the chronic diseases that are affecting so many people, many researchers believe go right back to disruptions in our bowel biome and our bladder biome and our urinary biome and just our biome in general. And so fecal transplants have been remarkably successful in helping people with bowel issues. Is that what does it do? It puts the right bacteria, the good beneficial bacteria in your gut, and that might be helpful. You can get the low acid coffees on our website, guys. Becky says, "Can I please show the first coffee again?" Yeah, absolutely. Bella Rosa coffee, and it was UC Davis, a coffee researcher at UC Davis, who was the one who discovered why this coffee is so bladder friendly, and that is because it has remarkably low levels of chlorogenic acid. So anybody who gets stomach upset, upset, or bladder upset, this would be the one to try. And know too that the coffee acidity ultimately depends on three things. It depends upon the altitude that the coffee bean is grown. Lower altitudes produce mellower coffee beans. Then it's about how it's roasted. And if it's air roasted rather than in a hot metal drum, the hot metal drum, when that comes in contact with a coffee bean, that produces excess acid. Um, and that's why most of the traditional large scale coffees don't work for us because they all are made in these giant hot drums. So that hot metal drum on the coffee bean produces a strong acid. Air popping is better. So Bella Rosa, as an example, they have an air popping roasting method. My nephew, who's a food scientist winemaker, he and his wife, they play with coffee beans in their popcorn popper, and that's another way of reducing acid. But the third way of reducing acid is in how you brew it. So a cold press, cold brew coffee extracts less acid from the bean than a hot brew. So the truly lowest level of acid you're going to get is if you use something like Bella Rosa coffee in a cold brewing method. And then, if necessary, you could use a little bit of pre-leaf too. Hi, Nicole. Sherry says she uses Bella Rosa coffee with Calciblend, blend, also known as coffee tamer. JK says, I am food sensitive. Do you think Ticino or low acid coffee would be safe? You know, I'm very food sensitive too. I did not like Ticino at all. Ticino to me was a very bitter. I do better with a real low acid coffee, but the one you want to try is, where is it? Dandy Blend. What I do with it? There is one herbal coffee that I think is way better than any of the other herbal coffees, and I've demoed it a couple of times. Okay, we have to find it. Where is it? Here it is. So if you want to try an herbal coffee, get this on Amazon, Dandy Blend. Again, we've demoed it a couple of times. I think it has a great aroma. Now, one other person tried it and said, hey, if you like coffee, this does not smell like coffee. I think it does smell like coffee. I don't get it. But anyway, the cool thing about Dandy Blend is that it comes in, it's a powder, so it's an instant, right? And you just dissolve this in, in a cup of water. And so I would try this one rather than the Ticino. So again, it's called Dandy Blend. It's got all the things in it. I mean, it's got everything that the Ticino has in it. So it's got roasted barley, rye, chicory root, sugar beet, but it also has dandelion root. I think it's odd, but it's good. I think it's pretty good for herbal coffees, and we've tested a lot of them over the years. April says the Bella Rosa is wonderful, and we do have. I don't. Oh, we used to have samples of Bella Rosa. I don't think we do right now, though. It's pretty affordable too. Tanya says, do you have any info on Zantac? I've gotten off of Prilosec and then Zantac 2. I do take pre-leaf. I don't, hun. Not off the top of my head. JK says, have you had any extra frequency from the Dandy Blend? No, but I don't do it a lot. I mean, my favorite, let me go get my favorite. Hold on. So I found this at Barnes and Noble years ago, and I was just at Barnes and Noble, and they have it again. They bring it in during the fall. Here, hold on a sec. Harney and Sons pumpkin spice rooibos tea, and this is my go-to. I love this herbal tea. So if you got a Barnes and Noble close, you should just be able to go buy a tin that looks just like this. Or we've got it in the IC Network shop, and we also have the refill things. You can buy, a refill bag. You can tell this is beat up. I've been using this tin for 2 years now. I just refill it, and it's these really interesting fabric tea bags, and it has a I can't describe it. I mean, it's they say pumpkin spice herbal tea, but it's not pumpkiny at all. It's more vanilla-y, like vanilla caramelly. I love it. So this is what I will do many times a week. That's my go-to. Becky says, I was drinking Puros for a long time, but sometimes I get it and it seems like it's gone bad. So I switched to Tyler's, but it's pretty expensive. Yeah, Puros is also based here in Northern California, and we sold it for years. But what happened is they hit the big national grocery store circuit, and so it doesn't surprise me that it was feeling a little old. I think going with the small custom lots, I know that's why we really like Bella Rosa, because they basically make it on demand, so we know it's going to have a good shelf life, right? Jim says, anybody in the chat know anything about pulse radio frequency, non ablation of the hypogastric plexus nerves for pelvic pain? No. Or about the dorsal root ganglion stimulators. I've worked with patients who have used them. Very, very few. I just don't have any details for you. I'm so sorry. I wish I had more to give you. You know, the enemy here is suffering, my friends. The enemy here is suffering. Um, if If you are in pain and that pain is worsening over time, the American Urology Association says it's very, very important that you revisit the diagnosis. We often see patients who are struggling with recurring pain, intensifying pain because they have untreated Hunner's lesions. And there comes a time when your pain is so intense that guessing doesn't work anymore. And yes, we need treatment for pain, but we also have to understand what is freaking triggering that pain. Is it a Tarlov cyst off of the lower spine? Is it an untreated Hunner's lesion? Is it pelvic floor muscles that are just so tight and locked down that nerves are being impacted? So while I absolutely support you trying nerve blocks for sure, I have no problem with that. I think that it's also important to take a step back with your doctor, revisit the diagnosis, and let's make sure something else hasn't been missed. Jim, I'll tell you, I've worked with a lot of guys. I've worked with a lot of guys over the years, and you guys are interesting, and you're interesting because guys don't often want to talk about it, and having conversations about their pain is something that is actually pretty rare for them, other than with a doctor. Um, but when they get to me, I'm pretty good at helping us try to understand the anatomy of it. And so, let me just, I want to offer you this context. Go back in time to when your pain began, whether it was a year ago, whether it was 5 years ago, 10 years ago, 15 years ago, 20 years ago. And I want you to think about what was happening at that time. Um, had you been on a long motorcycle ride? Were you a football player? Did you fall off a ski lift? Did you sustain a trauma of some type? Did you fall on your tailbone? Did you fall down a flight of stairs? Anything weird like that? One of the gentlemen that I've worked with for many, many years now, um, was actually, now I've worked with two patients that this has happened to, where they were run over as children, like, and in both cases. So the one I just worked with, she was run over on her left side from shoulder down her leg, and she had a broken hip and crushed pelvis on her left side. And then the gentleman that I was working with, he was run over horizontally across his pelvis and had a crushing injury of his pelvis. And they were both under the age of 10 when it happened. And they were by the time they got with us, they were in their 50s. They were in their 50s, and obviously had had long-term issues because of that. But with the lady that I was working with, it's so interesting is that none of her current doctors were really thinking about that original crushing blow. And say if they were doing things, like Elmeron. She'd been on Elmeron for 25 years, and was stunned when I told her about the Elmeron announcement. And it took a long conversation. I think we talked for about 2 hours for me to try to pull this information out of her. And she finally went, and I was like, "Did you sustain anything traumatic?" And she goes, "Oh, well, yeah, I was run over by a bus or a truck." It's like, "Okay, where?" She goes, "On my left side or on my right side." Her pain was on her right side. She was on her right side. And I was like, "Okay, do you remember anything about that?" And she said, "Well, they had me back in school in 2 weeks, and I thought it was way too soon." And she said, "I always felt like they never really took that seriously." And um, she had massive, I think now, I I want to say, I talked to so many patients. I want to get the details correct. I think she had just incredible adhesions along the right side of her pelvis, where most of her pain. Yeah, 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 it was her. And so it was all about trying to understand what that scar tissue and those adhesions were doing to her blood vessels and her muscles. So every patient is an anatomical mystery to be solved. And again, Jim, I'm just going to say that for the vast majority of men that I've worked with, we can usually trace it back to some sort of physical trauma. And that would be interesting to see if that was the same case with you. Lisa says her feed on YouTube is very choppy. That's just your internet, hun. There's stuff going on with the internet. It's kind of a miracle we've had a meeting today. So, but hey, you know what? Tanya says Health Wise on Amazon is very low acid coffee and comes in K cups. I haven't had any experience with it. It'd be very interesting to know what its pH is. Angela says, I love honey incense tea. The other stuff really, really tastes like real coffee, much better than coffee substitutes. Oh, good. You have a link in it. That's good. I'm glad you put a link in it. All right, you guys. Well, listen, we have been talking collectively for 3 hours. So let's do a last call for questions. Last call for questions. And we are going to have a giveaway. The question is, what should we give away? Hold on. I've got a whole pile of IC awareness stuff here. Okay. So we'll do a couple of giveaways today, okay? All for IC Awareness Month. Our first giveaway is going to be this gorgeous t-shirt. And I know it looks wide, but this is a boxy short t-shirt. And it's actually a size medium, I think. Let me look. Yes, it is a size medium. So I have this one in white. All right. Now the question is do I keep this one or not? I might keep this one. We have in purple. I'm not ready to let that one go. I mean, these are brand new. I've never worn them. Obviously, I ordered them to give as giveaways. Let's see. What else do I have here? Oh, yeah, look at this. Okay, this is a beautiful tunic. See how long it goes? For those of us who like to cover our tushies. Okay, so, let's see here. Or look, this is a gray tunic. Yeah. Okay. Okay, so this is what I'm going to say. I'm going to say that both of these would work for a size medium or large, not extra large. Okay. So we're going to give one to YouTube, one to Facebook, and the person who answers the question first gets to pick which one they want. Okay. And then the other person will get the other one. So now we need a good question. Nikki says, can you participate if you're outside the US? It depends how far. If you're over an ocean, then it's going to cost me $50 to ship it to you. And frankly, we don't have the sponsorship to be able to do that. But that doesn't mean that I won't give you something by email. I could, we could give you, if you win, we could give you a year subscription to our magazine or something like that instead. Okay. I did just send a mug to Canada and it costs $35 to ship it. Like, yikes. All right. Okay. So here is our question. So we were talking about anxiety earlier, and we were talking about how a certain chemical in your bloodstream is what helps you flee, fight, or fly. And that when you struggle with anxiety, your goal is to reduce the levels of this chemical in your body. And that is your question. What? Okay, JKA and Donna. I love it. And JKA, so the answer is adrenaline. So Donna actually did answer it first. So Donna, you get to pick. Do you want the tunic or do you want the short boxy one? All right. So Donna wants the tunic. And so JKA, you're going to get the boxy one, okay? And so I need, Donna, I already have your mailing address. So here, hold on a sec. Where are my Post-its? So JKA, I need you to email me, icnetwork@mac.com. I need you to email me your address, okay? All righty then. Okay. I will ship those off tomorrow. And I would appreciate all prayers. We are entering another fire season starting tomorrow. Everybody is saying high winds, low humidity, and to be on the lookout. Remember, my town burned we lost 5,000 homes 2 years ago, and my house was surrounded on 3 sides by fire 2 years ago, and we had to run for our lives. And luckily we didn't burn, but we have been told that that is starting again tomorrow. Try not to have PTSD about that. Easier said than done. Kay says, your dad is a very nice looking, very young man. No way does he look his age. And I was very surprised at how young he looks. Yeah, he's 96. He'll be 97 on Veterans Day. Guys, you were awesome. Look at last week. You guys had trouble with it this week. Look at all these people who guessed adrenaline. I am so proud of you. Good job. Excellent. All right. I'm looking at you right now. Some of you think you're damaged goods. Some of you think that you're unworthy. Some of you might think that you don't deserve a good life. Some of you think that you're being punished. And I want you to stop it now. You're stopping it now. No more of that negative self-talk. No more of thinking that IC defines you. Bullshit. IC is below the waist. IC does not change your brain. It does not change your heart. It does not change your soul. It does not change your ability to be a mother. It does not change your ability to be a wife. It does not change your ability to be a friend, a daughter, a son, a husband. You are hurt. You are hurt. But it is 2019. We're not dealing with the dark ages. Okay. Back 40 years ago, it was terrible. 20 years ago, not so good. Today, we have subtyping. Today, we understand the many different things that can trigger bladder and pelvic pain. Today, we're getting better at diagnosis. Today, we are getting better at finding the right treatments. Today, there is support. You are not alone, but do not hide in your house. Please, God, there's nothing to be embarrassed about here. Nothing. I think what's so interesting here, I got to tell you, and I'm being perfectly honest here, the gift that IC gave to me, aside from work that I'm really, really proud of, are the amazing friends that I've made that before I see, my life was pretty superficial. That I really thought that when you're young, you think money is the answer to everything and having the right clothes and the car and all that sort of stuff. And then bam, bam, you get injured, you get hurt. And all of a sudden you realize that none of that matters. What matters is having people near you. What matters is having people who will care about you. And what matters too is you being able to use this experience to help somebody else, because you will never, ever, 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 ever walk away from someone in pain, because you know what it's like to be in pain and be alone. And that is a tremendous gift, to be the person your family can rely on. I mean, I'm the youngest in my family, and I had, my brother's best friend was here, and he made a comment about how the youngest in the family tend to be the spoiled ones in the family and tend to have an easy life and yada yada yada. And he goes, "Not you. You're the exception." And it's like, no, I'm not really the exception. Um, um, the gift of facing something like this is it helps you focus on a healthier life and the right things, like building good relationships with family members and friends and being there with each other and being there for each other. Some of you in here, I consider very, very good friends. And I will call you and talk to you and see how you're doing, and you will call me. I would never have met you without this. And I am so grateful for your friendship. And you down on YouTube, I'm looking at a couple of you down there. I'm so grateful for you. I'm so grateful for you. But it's work. It's work. When you're diagnosed with something like IC or IBS or ulcerative colitis, it is a major reality check in how you are living your life. And for some of us, myself included, it's about looking at the things that we've done that have not been particularly healthy, whether it is eating a lot of junk food, drinking a lot of coffee and energy drinks, or being on the computer too long, or facing an addiction, smokers. I was working with a patient who is really interesting, who she kept saying, "I'm doing everything, 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 everything I can do to be healthy." And I was like, "Okay." And she goes, "But I smoke." Then you're not doing everything to be healthy, because smoking is the number one cause of bladder cancer. And so there is a sense of personal resolution, that we resolve to improve things that we know we're not doing quite as well as we could. And so if you're a smoker, come on, guys. If you smoke a pack a day, come on, reduce one cigarette every 2 days. And within a month, you'd be down to one a day. And our goal is to get you off of it, because we want to save your life and we don't want you to have bladder cancer, right? And we don't want, especially if you've got IC, the worst thing you do is smoke. And if you have Hunter's lesions, it's a wide open door for the carcinogens to go into your bladder wall. So we're doing that. If you're a junk food junkie, it's time to go organic. If you rely on fast food and don't know how to cook, maybe it's time for you to learn to cook. If you have not been very good physically, maybe it's time for you to get physical, because the more you move, the more your body produces natural endorphins, which are natural pain fighters. The more you lay down, often the worse you get. Your body is wired to move. So we want you to try to move slowly at first, I mean, set a realistic goal. Walk down the front door, the front walkway of your house a couple of times a day. In a couple of days, walk one house away. Within a week, try to walk a block. Go slowly. Talk to your doctor. See if you can do. But I'm just saying that the best patients are not the patients that live in denial. The best patients are the patients who go, "What can I do to be better? What can I do to support a good, healthy life with my body? What can I do to support and enhance healing?" And a lot of times, for some of us, it's just about dealing with bad habits and being stronger because of this. Um, I personally really like to challenge myself every year. I pick a really hard resolution, And I'm really proud of myself because for the last 5 years, I've met all of my resolutions. This year was no ice cream and frozen yogurt. So I haven't had any ice cream, any frozen yogurt for the year. Last year, it was no coffee. The year before that, I went 1 year without buying clothes. I went 1 year without, anyway, pick something hard because you're freaking strong. You have never been stronger than you are at this very moment because you are truly one day older and wiser. Don't worry about a mistake that happened 20 years ago. You're not going to make that mistake. You'll learn from that mistake. You have never been more prepared to deal with whatever happens to you than you are at this very moment because you are truly one day older and one day wiser. Embrace it. Embrace it. You are not damaged goods. You are simply a man or a woman who is hurt. And you deserve the love and compassion of the people around you. Don't hide it. Ask for it. Okay? You have 5 pieces of homework for me. I'm giving you 5 pieces of homework before our next meeting, which I will also do this week. 15 minutes for your spirit. I don't care what it is. Do something that will give you some calm and comfort. For me, it was listening to Joe. I have this, so like I have this really weird thing. Whenever my computer isn't working right, or whether something isn't working in the car, like Sirius isn't working, or something isn't working in the car, or I was trying to listen to a book on tape yesterday. I was trying to listen to an Anne McCaffrey, The White Dragon book on tape, walking, and it just wouldn't work. And I always feel like there's an angel on my shoulder going, that's because there's something far more important that we want you to do right now, so I just turned it over to Joel Osteen. And oh my God, it was like exactly what I needed to hear. Because he talked about how when you're faced with something, you have to, number one, care for yourself. But there comes a point in time when you then move to caring for other people and offering hope for other people and encouragement for other people. And that he was saying that by helping other people, you help yourself. And I was like listening to this walking yesterday going, yes, yes, yes. Because when I started my support group and I got that context, before I started my support group, I thought I was the worst person ever diagnosed. I thought I was the only patient in California. I thought my life was over. And then I opened the door and let other people in. And the gift of those other people is they taught me context. And what I thought was bad wasn't bad because I worked with patients who were a lot worse. And then that helped me understand and see that, maybe what I thought was really bad really wasn't that bad. And all I can tell you is the more I did that, the better I got. I worked hard. I do physical therapy. I do other stuff. But ultimately, in the end, if you get out of your brain and take a moment and do a random act of kindness for somebody, whether it's an IC patient or somebody in your family, that is your second piece of homework. I want you to commit one random act of kindness for every person in your home. And if you're alone, then do it for somebody that you care about. Do something for somebody else. Just get out of your brain, do something for somebody else. Okay? That's your second piece of homework. Your third piece of homework is to do something for your bladder and or your pelvis. Like really, could you just please get down on your hands and knees on your living room floor and do the pelvic floor exercises they told you to do, which I have not done in 2 days, but I did a lot this week, so I'm proud of myself, but I've got to do it again. So 15 minutes, go do your PT. For let's see. All right, now come my brain is zoning. So we're doing for your spirit. Oh, okay. For 15 minutes, I need you to work on your noggin. I need you to work on your knowledge level. Because seriously, I mean, I'm so frustrated with Facebook right now. I'm so frustrated with it because Some of the information on Facebook is so reckless and dangerous, it's nothing short of astonishing. You should not be getting your IC information from any social networking site. You got to credibility check it on a real website or the National Library of Medicine, for God's sake. So if somebody says they can cure you with something on Facebook, Google it. Come to our website. Call me, and I'll tell you if I know if it's reasonable or if it's not reasonable. Um, but beware of people selling false cures because it happens. It happens. We have been having a big issue with the role of chronic infection, chronic bacterial infection, with a lot of cheap shots this week since our last meeting when we got rated. And I'm standing firm here. Listen, we have subtyping. Not everybody has chronic infection, but some of you could. And I think that's important. Okay, your last piece of homework. Your last piece of homework is to laugh. It's to laugh. Because when pain is accompanied by laughter, your brain minimizes it. So would you please, 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 please leave your IC groups, leave all that stuff at the end of the day, go over to YouTube and watch something funny. We've, and cat videos, whatever. I do it every night. I do it every night. Only I watch gaming stuff too. I just look for funny things. Wimp.com, WIMP.com, wimp.com has 5 funny videos a day. That's a great place to go. But we need you to laugh too. Do not sit here and read icy stuff all day and watch these videos all day. That's not healthy. I need you to get out and do other wonderful things too. Okay? Good night, Donna. Donna, thank you so much for everything you've done for IC Awareness Month, girl. You rock. And I'm so proud of you. And I'm so happy with my friendship with you. You're just amazing. Kay says, how old is your mom? She is 90. What is the secret? The secret, there are 2 secrets. Number 1, everybody in the family on both sides live until their late 90s, which is terrifying because they all have pensions. I do not have a pension. And so the thought of paying for myself when I'm 90 to 95 years old with no children and no husband is terrifying. So in this family, as long as you're not a smoker, even though my mom was a smoker, they live a long time. But the other thing that really has made a huge difference is that I'm here and I'm going to own it. I'm going to own it. I work my butt off to keep them healthy, and I've saved my dad's life twice now. Because he chokes easily. And so having somebody close by, I think, is really important. We agreed that we were not going to put them anywhere, that they deserve the opportunity to grow old gracefully in their home. And that's exactly why I'm here. But it is hard. You see these wrinkles? Yeah. All right, guys. Again, if you won a t-shirt, JKA, please email me, icnetwork@mac.com. Everybody else, you're going to see me this week. I'm not sure what day, but I'm going to be doing it again. And again, please, 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 icawareness.org. You got 10 days to go. If not you, who? You got 9 days. Let's kick some butt with this. We got 9 more days to kick some butt. And I really need poster entries and I need meme entries, and you could win $100. So why not do it? All right, guys. See you later. May you sleep well and have a wonderful week until we meet again. Thank you, Kay. Kay, yeah, Kay, I'm 59. Would you believe it? I was thinking about that today. I feel 25. Honestly, I feel 25 years old. It is nothing short of astonishing that I am actually 59 years old. It's so weird. And I was thinking today, going, oh my God, in 20 years, I'm going to be 79. But 79 is the new 59. 59 is the new 39. So I'm just going to live young. I'm gonna try, but I gotta be able to pay for it. That's the hard part. So, all right, guys, I'll see you later.